Let's talk about what PocketRN is. 'Cause I know your tagline is your nurse for life.
Exactly.
Can you just explain to my listeners how the platform works exactly and
Yes.
how it is actually helping bridge the gaps between, health and healthcare?
PocketRN is a virtual nursing platform and service. So yes, there's an actual platform that does the matchmaking of nurses to patients and things like that to make sure they're
Mhm.
in the right specialty and that they have the right training and of course the licensure and things like that. But beyond that, it is what we call kind of like a new nurse-led care delivery model. And so basically what we talk about is that tagline for Nurse for Life is that, if you have a nurse in your family, whether it's a friend, family member, neighbor, it's that person you turn to for like everything, right? Like
Yeah,
something's wrong
yeah.
with your family member. You're
They're your
like,
go-to.
you text them, you send them
Mhm.
photos of the rash on your child, or it's
Mhm.
that person you turn to when you want advice on like, what do we do?
Yeah.
What should we expect? Who do we, what specialist should we ask for? Is this a normal progression? Do you agree with what the doctors are recommending for my mother? Like,
Yeah.
you go to that person for that. And so, the vision for Pocket RN is how do we democratize that? Like, how do we
Mm.
offer that nurse for life for anyone who doesn't have that in their network? What we found is, we have partnerships kind of across the board in terms of from large academic medical centers to federally qualified healthcare centers to,
Mhm.
non-medical home care, and more. And the most exciting thing for us that we're getting ready to launch this summer is the GUIDE program, which is Medicare-based dementia program that helps provide services to patients. And especially the focus for this one are the caregivers, right? So
Mm.
caregivers are the ones who are often the most burdened with trying to navigate our very complex health system while also navigating all the changes that are happening with their loved ones at home. And, dementia, there's different types. And then even the progression of disease is so different for each individual. And so
Mm.
having a nurse who has seen that and can walk you through as a family on like, how do you manage these changes that you're seeing with their loved ones? What do you do when they start not recognizing people? All those different things that are not only so heartbreaking, but also just confusing for the families, and they don't know how to best to love them and care for them and support them, and they're having to do this all day, right? And so we're really excited because the guide model is really a way to just it is our nurse for life model, like in real life, right? And so we're
Yeah.
really excited to be able to launch that and provide that kind of support for patients and families.